Speaker is Emma Savage. Emma is the operations manager for the Milk Bank in Chester. She's worked at the Milk Bank since 2014 in various roles, having first found out about milk banking in 2011 when donating to Chester Milk Bank. Emma's mum to Harry, aged 13, Katie, aged 11, and Lucy, who died shortly after birth in 2010. And she is passionate about improving equity of access to milk, to donor milk, and supporting bereaved families. So welcome, Emma. We're looking forward to hearing your talk now.
Hi, yes, thank you, Gillian. And I just want to say thank you to Tanya, first of all, for inviting me along. So I will just try and share my screen now. So hi, my name's Emma Savage. I'm from the Milk Bank at Chester, which is one of the biggest NHS milk banks in the UK. We supply about 45 different hospitals every year with donor milk. But I'm here today to talk about the Memory Milk Gift initiative, which is something that we launched in the middle of last year, summer 2021, to try to improve the service that we were offering to bereaved families donating milk to us. So our mission statement is very simple. It's that we believe that every bereaved family should be given the choice to donate milk in memory of their baby. This is something that that Cora talked about. We need to make this choice available, but we really understand that this is it's not for everybody. Everybody's individual circumstances are different, but it's really important to make families aware that this is a choice so that they can make an informed decision about their lactation choices following loss. We set this initiative up in June 2021 with the aim of improving the service we offered and the support we provided to bereaved families. So why is this something that we wanted to raise awareness of? Ayala Orig's study from 2019 highlighted a number of benefits to donating milk after loss. Donor identity serves as a transformative identity while coping with loss. It empowers bereaved mothers and can help them to heal. And bereaved mothers' affiliation with milk banks can strengthen their social networks. So prior to the Memory Milk Gift, so this was prior to summer last year, we supported an average of 1 bereaved family per month to donate to the milk bank. They were usually retrospective donations of milk, which means that the donor had already expressed the milk for their own baby while their baby was in neonatal care. It was very rare that we had donors who were initiating lactation following loss. I think there was only 1 or 2 examples of that happening while I've been at the milk bank prior to this initiative. We provided memory pebbles to donors, a certificate and a generic thank you card to all families. We didn't have a bereavement lead role in place at that point, and information about donation after loss was quite difficult to find on our website. It wasn't in a very prominent position at all. We were working closely with several hospitals, mainly hospitals that were in our local area, who were referring bereaved donors to us, but that was quite limited to a handful of hospitals that were aware about donation after loss and were kind of actively making families aware of it. And we did have some leaflets available that we provided to hospitals. So what we did when we developed this initiative was we had a financial donation from a bereaved family, and as a team we all felt it was really important that we use this donation to improve the service we offered to bereaved families. So the initial thing that we did was to set up both parent and professional focus groups, because we wanted to get feedback from families who had donated after loss and feedback from the healthcare professionals that were dealing with bereaved families every day about our service and about how we could improve it. We also did a survey of milk banks in the UK to try and understand what the current situation was, to understand who was able to support bereaved donors and what their current service was to families. We found it was quite patchy, it was quite different in different areas. So that's something that we hope that this initiative could provide support with. We wanted to develop our memory making opportunities, which I'll talk about shortly. And we then used the imagery from the memory milk tree that we created to create a more gentle image to use in all our communication with bereaved families. So on the top left of the slide there, that is our logo that we use for Memory Milk Gift. So that goes on to any letters sent to families. It's used on our social media channels. We also put it on the outside of any correspondence sent to families so that they know that it's come from us before they open it. But it's quite a subtle image, really. It's not obvious to those who don't know what it is, what's being sent to them. We updated our website to ensure that donation after loss is in a prominent position. So it's now on the main page of our website, and it just takes one click to access that information. And we've been careful to not include any baby photos on that section to make it more gentle for families. We created a dedicated bereavement lead role to act as a single point of contact for families. The idea was that families would then not be having to tell their story again to different staff members. They would have one dedicated contact. Our bereavement lead is Laura Atherton. She's been absolutely integral in developing this and raising awareness of this. Her passion for this is incredible. We created a pathway, but due to individual circumstances, we were very aware that this needed to be personalised to individual families. So there is scope for it to be personalised in terms of how much contact the family want from us. Would they prefer us to be in touch by phone or by email? What memory making opportunities do they want for their family? So we are very aware that we tailor that to each individual family. And we also set up memory milk gift pages on both Instagram and Twitter, because we felt it was really important for families to have a safe space where they could talk about milk donation that was separate to our Milk Bank at Chester kind of standard pages. So memory making opportunities are really important to the families that we're supporting. The opportunity to make memories with their baby are very limited. So anything that we can do to acknowledge their baby and their baby's legacy is really important. So we offer 4 different things to families. The first thing is the opportunity to have their baby's name added to our memory milk tree. The memory milk tree is on the left here on the slide. It's over 6 foot tall. It's painted on the wall in the Milk Bank at Chester. And it was designed by a member of our processing team, Kate Buckley, who designed it with the idea of it looking like a milk drop kind of shape. I don't think you can probably see closely enough, but in the centre, the baby's names are added to it. It has a milk drop shaped leaf next to each of those names. And again, I don't know if you can read the bottom, but it says there is no footprint too small to leave an imprint on the world. So we offer this to families, and the majority of families take us up on this. Once their baby's name's been added, we then send them a photograph of the tree so that they've got it for themselves. We also offer, the middle picture is a card that we provide to families. So again, Kate from our processing team personalises these with the baby's name across the middle of the tree. We've had some families that have asked for more than one copy of these because they want to share them with wider family, and we can provide as many of them as families want us to do. And then the final thing is the memory milk pebble. So you can see one side here with the thank you written on it. The other side has the baby's name, and they're beautiful. They're varnished, so they're really shiny and they're really lovely to touch. And a lot of families find these, they're very tactile. It's something that they can hold, and it's something tangible to remember their baby and their baby's legacy. We also send a thank you certificate, and on that certificate we include both the lactating parent's name and the baby's name together, and it gives them the amount of milk that they've donated, and says thank you for your certificate of thanks for your donation to the Milk Bank. So as I said before, not all families take up all of the memory making opportunities, but hopefully there is something there that they may want to take us up on. And they can access these at any point during their donation journey. We've had people that have come to us that have donated in the past, before we set this initiative up, that have asked for us to provide these memory making opportunities now. So we're more than happy to do that. And we've also supported other milk banks if they haven't been able to provide something along these lines. we can provide the memory pebbles for them as well as part of this initiative. So our focus groups raised quite a few different barriers to donation after loss. And I think it's important to say at this point, I'm really sorry to anybody who may be on this webinar that has experienced these barriers. We're trying really, really hard to lower these barriers in the hope that people won't come across them in the future. So the barriers we came across were there wasn't a standardized process or approach from milk banks. We've actually found that some families were turned away and weren't able to be supported, which we're hoping to prevent in the future. We found that information around donation after loss was difficult to access. There was a fear from healthcare professionals of suggesting milk donation and a donor then being subsequently turned away by the milk banks. There was questions around how to start the conversation, how could that be brought into a discussion with bereaved families, and a fear of overloading the family with information when they're going through a really traumatic time. Also concerns around transportation of milk, depending on where the hospital was located or the family was located, whether milk banks would be able to collect it, and fear about the family being asked to return to a hospital or healthcare setting for blood samples to be taken for donation purposes. And the final one we came across was lack of a breast pump. So we've worked quite hard to try and reduce or lower these barriers for families. So we're trying to simplify and share processes with other milk banks, including supporting them with memory making opportunities, as I mentioned previously. We have an option for milk banks to join the Memory Milk Gift Initiative as a signposting milk bank only. So what that means is if they don't feel they have the capacity to be able to support bereaved donors, rather than turning them away, they will signpost them to another milk bank that is able to accept their donation, or signpost them to the Memory Milk Gift, who will be able to find an appropriate milk bank for them. We've spent time making information a lot easier to access on our website, leaflets and social media. We've also started to offer the option of donating for research purposes. So this would be in circumstances where donors were perhaps taking medication that wasn't compatible with donation for hospital use, or if somebody in the household smokes, etc. We can offer the option of donating that milk for research purposes. We have in-house research that we're doing. We are looking at nutritional content of milk for the first 28 days. And we also have 2 different research projects taking place with the University of Chester and the University of Cambridge. So this is something that we're keen to develop in the future and work with more universities if we possibly can. The feedback from our parent focus group about when to raise this was, if a conversation is happening about suppressing lactation, that's the ideal time to talk about milk donation as an option. It seemed very obvious to our parent focus group that that was the time to raise donation as an option. We've also started to provide information packs to healthcare professionals, which has a variety of information in it. There's information all about the Memory Milk Gift Initiative. There's also various different consent forms and screening forms to establish whether somebody can donate for hospital use or donate for research purposes. So we've tried to make things as simple as we can for healthcare professionals and give them all the information that they need. We're also working to support healthcare professionals to take blood samples before a family leaves hospital. So this means they're not then going to have to go back into the hospital or to go into a GP's practice to have those bloods taken at a difficult time for them. It means that part of the process is done before they even leave the hospital. We're able to collect milk from anywhere. We've facilitated donation in the past from Ireland and from the Isle of Man when a local milk bank has been unable to take it. So geography really isn't a barrier to this at all. And we're also able to provide breast pumps for families. So we have a partnership with Ardo Medical where they hire the breast pumps to us at a reduced rate. They have amended their leaflets to make them appropriate for bereaved families. There's no mention of breastfeeding a baby. There's no photographs of babies on the leaflets or anything like that. So that's something that we can offer. So this is an update from May this year. So the initiative has been running for just under a year now. So at the beginning of it, we were supporting one family a month. We're now supporting an average of one family a week. So these families were obviously out there and may have wanted to donate, but the awareness wasn't there that this was an option for them. 4 of those families chose to induce lactation. 3 of those were after their baby was stillborn, and 1 was after a very early neonatal death, and 2 donated ongoing after their baby had died. We've provided breast pumps to 3 families to enable them to donate. We have 7 milk banks now signed up to the Memory Milk Gift Initiative. So they are the tree images. Are they not coming? So the tree images there that have just come up on the map are the milk banks that are signed up to the initiative. So there's quite a lot of coverage across England, Scotland and Wales. Nothing in Ireland currently, but I think the Irish Milk Bank have their own ways of acknowledging donation. We've been presenting on 4 different neonatal networks palliative care training to raise awareness. So those are the large milk drops that are coming up, and sent bereavement packs to over 40 different hospital teams, which are the small milk drops that are coming up. I think now the hearts that are appearing now are bereaved families who have donated since the initiative started. So it's quite a lot of families over a large area of the country. A couple of weeks ago, we launched a podcast with our Sam Baby Loss charity, and that was talking about lactation after loss, and was released on the World Day of Human Milk Donation. So there's a variety of people involved in that podcast. Sharon Breward from Betsy in North Wales was on that, and Nick Embleton from Newcastle, and Laura from the Milk Bank team. So that's a really, really good podcast. If anybody wants to listen to it, it will be on our social media channels. You'll be able to access it on there. And we also had that collaboration covered on ITV Wales last week. So that was a really nice piece, just a short piece, but really helping to raise awareness of this as an option for people. Just wanted to give everybody a little bit of time to read this feedback. This is just some of the feedback we've received from families that we've supported. So our future plans, we would like to continue to raise awareness and help to empower health professionals to offer donation after loss as routine. We're aiming to work collaboratively with more milk banks. I believe there is a Scottish memory milk tree in development. I think that is going to be launched in the autumn. And we were also starting a partnership with Ottawa Milk Bank to support them with supporting bereaved families. It's really, really important that we know our limitations. We're not counsellors, we're not bereavement support staff, we're milk bank staff. And because of that, we need to be able to signpost families to appropriate support. So we're working with our SAM to develop a bespoke section on their website. So we will include the QR code for that on all of our leaflets going forward. And our SAM are also going to provide us with effective signposting training, which will be open to all of the milk banks that are signed up to the Memory Milk Gift Initiative, so that we can feel confident that we're able to signpost to the right organisations. We'd like to introduce donation after loss into antenatal palliative care planning, and we're working alongside Forget Me Not Children's Hospice in West Yorkshire to work out how that can be done. There's also potential research in the future into the benefits of donation after loss and mental health benefits of donation after loss for donors. And going forward, we are going to look at storing 1 bottle of milk from bereaved donors. We've had recent circumstances where luckily we did still have some milk in the freezer. A family had decided they wanted to make a milk memento, but they donated all of their milk to the milk bank. Thankfully, we still had some in the freezer and we were able to provide that to the family. But going forward, we would like to store 1 bottle for them in case in the future that's something that arose. So that's something we're always looking to develop what we do, and any feedback, we're happy to change our processes, and that's something that's just come up in the last couple of weeks. Hopefully that gives you an overview, but I think the best person to tell you about this is Holly, who's one of our donors. So if I just play this video, she can talk about it a lot better than I can.
Hi, my name's Holly and I donated my milk after my son passed away at 41 weeks. He was stillborn. Whilst in hospital, no one told me or explained to me that I could donate my milk, something that my body was going to start producing, because even though my son had passed away, he was still going to be born, and my body thought that he needed to be fed. Whilst I was waiting for the induction medication to work, which takes 48 hours, I started doing some research about baby loss, about what my body was going to go through. And somewhere I stumbled across the fact that I could donate my milk, that I could donate Bodhi's milk. Straight away, I knew it was something that I wanted to do. I wanted to do in his name. I wanted something that I made for him to go to other babies, to help other families not go through what I was going through, what I have gone through, what I still am going through. All the hospital did was offer me medication to stop my milk. And to be honest, when I told them that I was going to donate my milk, some of my family and some of the consultants and midwives, they were concerned for my mental health. But actually it was the best thing for my mental health. It gave me a reason to look after myself in a really dark time when otherwise I'm not really sure what I would have done. Who knows? Maybe donating milk in a way saved my life. Because it really did make myself, cook myself meals and, you know, be hygienic. Little things that most people take for granted, but when you're going through grief, it doesn't come naturally to want to look after yourself. So I'm really grateful that I came across the milk bank at Chester, because I tried a few other milk banks before and none of them wanted to work with me. In fact, one of them said that they couldn't offer me the pastoral help that I needed. No one needed to give me pastoral help. I was going to be grieving regardless. Still am grieving, will be forever grieving. I just wanted to donate my milk. I wanted to donate Bodhi's milk. I wanted him to leave a positive mark on this planet, like I always had hoped that he would. And through my milk, through his milk, through donating with the milk bank at Chester, his name lives on. He is a little light in a sometimes dark world. His milk helped potentially hundreds of families not go through the pain that I still go through. I just want hospitals to inform all families of milk donation. And even though it seems like a really hard thing to do when a family has lost something so precious, actually it can provide a little bit of hope, and that you don't always have to tread on eggshells. Sometimes a bit of information can really lift a shattered heart just a little bit, like it did for me. So thank you for listening.
I'll just leave it on Holly's words, because I think she's absolutely sum things up perfectly. So I'll pass over to you, Tanya.
Oh, thanks, Emma. And Gillian will continue. I just wanted to make one little point while you were talking. Anne McRae, who, as I mentioned, was the one of the founders of the Northern Irish, or the All Ireland Milk Bank, made a point about reminding us that we have been talking about this for a long time in Ireland. And what we ended up arguing, and part of this was connected to the master's level work that Denise did several years ago, but it's also, it predates that as well, is that there's a culture of talking about death in Ireland, that now we're seeing that culture spread to other parts of the UK, thanks to the Memory Milk Project, which I think is wonderful. So I'll turn it back over to Gillian. So